When chemotherapy is used to treat cancer, the toxic nature of the medicine can cause serious side effects. To keep you well beyond a diagnosis, scientists are combining old drugs with new ones to improve cancer treatment. Doug Johnson explains.
Chemotherapy medications are a powerful weapon in the fight against breast cancer. But the power of those drugs can cause serious side effects because of their strength. Women getting chemo can suffer hair loss, nausea, and even damage to healthy organs. Because of that, drug makers look for ways to lessen those effects while still destroying cancer cells. A recently approved drug, Kadcyla, or T-DM1, uses a new approach to treat what's called HER2 breast cancer.
HER2 amplified breast cancers are what we have in about 20% of folks with breast cancer. HER2 is an oncogene that drives the breast cancer and causes it to grow and to spread through the bloodstream to other areas of the body like the liver and the lung and the brain.
The new drug combines two medications. One, Herceptin, focuses on the cancer cells. The other is a chemotherapy drug called DM1, which is too toxic to put directly into patients' bloodstreams. Dr. McGee says using Herceptin to deliver chemo directly into cancer cells without destroying healthy cells is what's exciting about using the combined drugs.
The analogy is weapons of mass destruction versus smart bombs. We hate to think of chemotherapy as a weapon of mass destruction, but it's similar in that there's a lot of collateral damage with standard chemotherapy. Nausea and vomiting, hair loss, and so forth.
But right now, the medication is only used as a second-line therapy for metastatic breast cancer. That's cancer that has spread to other parts of the body after initial chemo, surgery, and radiation. A clinical trial of women with advanced HER2 breast cancer showed those getting the new drug lived about 6 months longer than women getting standard chemo, totaling about 2.5 years of life after the first diagnosis. But there are other drugs that are under development that would allow a similar focused approach for types of breast cancer that affect even more women.
Although chemotherapy is still considered our backbone of therapy for most cancers, including breast cancer, we are gradually moving away from chemotherapy toward more targeted therapy.
The National Cancer Institute says targeted cancer therapies will not only deliver toxic drugs directly to cancer cells, but eventually even interfere with the cellular growth of those cancer cells. For Smart Medicine, I'm Doug Johnson.